If everyone could rise for our invocation by Chaplain John Gerhardt.
Thank you, Chairman Carter. And would you bow your heads with me as we pray? Lord our God, we know that the Scriptures tell us that it is good to give thanks. So we pause in this moment to recognize our manifold blessings. We thank you for the free land in which we live and the privilege of casting our votes to choose our leaders. We're grateful for the beauty of this seaside community that we are privileged to call our home. We're thankful for the blessings of life and health for ourselves and our families. And we thank you for this hospital board and their faithful service and support. And ultimately, our God, we give thanks for the high calling and the sacred trust of caring for the ill in our community. Bless this day all the patients and families found to be in our care. Bless them in body, we pray. And grant them peace in the midst of their difficulties, we ask. And may we who serve them be your hands and your feet, bringing our patients care and compassion, strength and support, that they too might also be able to give thanks. These things together we pray. Amen.
Amen. Please join me in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God,
indivisible, with liberty
and justice for all.
I'd like to call to order the meeting of the Sarasota County Public Hospital Board. I'll start by reading a public comment. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. On behalf of the board, I'd like to welcome our newly elected board members, Sharon Wetzler DePeters, and she takes the at-large seat 1, and also Susan Tucker, who was elected to at-large seat 3. I'd like to congratulate our board members who were re-elected, Tram Hudson, Bill Noonan, Jim Meister. And also, I'd like to welcome Mason Ayers as the president of the foundation, Sarasota Memorial Foundation. And we'll start with approval of the orders of the day.
So moved.
We have a motion and a second. If there's no questions, the orders are approved as written. Then we'll move to approval of the minutes of our meeting of October 17th.
So moved. Second.
And if there are no comments, those minutes are approved also. I'm going to take the chair's prerogative and step to the lectern to honor our colleagues. At this time, I'd like to ask Dr. Marguerite Malone to come forward, please. Marguerite? Marguerite has been a board member on our board for 12 years. This is something that she was, I think, our second most senior person on the board. With time, this is something that takes a lot of dedication. And I have to say, I think she was one of the most dedicated people on our board. She has been a strong advocate for so many years to pass along the word of Sarasota Memorial Hospital to the community and represent our hospital with pride. And I thank you so much. And we as a board thank you. We appreciate your service very much. Thank you. I have a resolution, and the Sarasota County Public Hospital Board, whereas Marguerite G. Malone, EDD, is hereby honored for her outstanding service and distinguished 12-year term on the Sarasota County Public Hospital Board. And whereas Dr. Malone demonstrated visionary leadership throughout her tenure, providing a wealth of wise counsel, common sense, and unparalleled expertise, and has played a major role in Sarasota Memorial's continued recognition as a top quality health provider and strong community asset. And whereas Dr. Malone provided skillful governance during the health system's strategic growth over the years. During her 3 terms as chair of the board, she expertly guided the organization through the opening of critical new facilities, including the freestanding emergency care center in Northport, urgent care centers throughout the region, and the 9-story courtyard tower. She presided over the successful launch of the hospital's new trauma center and FSU physician residency program, and led a seamless and successful CEO transition. And whereas during Dr. Malone's tenure on the board, Sarasota Memorial was continually recognized for its superior care, earning a 5-star quality rating from CMS, multiple magnet nursing designations, U.S. News recognition, the Gallup Workplace Award, Leapfrog A grade in patient safety, Truven Top Hospital Honors, and many other national awards. And whereas Dr. Malone's commitment to SMHCS has been second to none, she generally devoted her time and expertise to all matters and activities connected to the organization, including innumerable committee meetings, employee gatherings, healthcare foundation functions, speaking engagements, community events, and appointments with hospital advisors. She has been an unwavering champion for SMHCS and its physicians and staff, repeatedly and tirelessly traveling to Tallahassee to advocate on behalf of the hospital on key healthcare issues. And whereas Dr. Malone is much admired for her integrity, diligence, and deft stewardship of the health system, she has always been committed to ensuring the organization provides world-class medical services to the community. Now, therefore, be it resolved that although Dr. Malone is completing her tenure on the board, her colleagues, the organization, and the entire community will long benefit from her exceptional governance and invaluable contributions. Be it further resolved that Marguerite Malone will be honored for her outstanding leadership, and her name and accomplishments will be set down upon the records of this great healthcare system. It's signed by David Verinder, our President and CEO, and myself as Chairman of the Board. And it's approved today, November 22nd. Congratulations so much.
Can I say a few words?
Of course.
No, you're my friend. So I just want to say just a couple of things. I can never come close to mentioning all the things that Mr. Carter just did in your plaque. You're well deserved. I've been here have had the privilege of being here for 10, almost 11 years now. And Dr. Malone was on the board when I came here, and she took me under her wing and really helped me get acclimated to Sarasota as a community and to this organization, and I'll never forget that. I had the privilege of calling you boss for the last 2.5 years, okay? And I can't thank you enough that I got to sign your plaque, okay? So, but anyway, we'll always love you, and you're our friend, and thank you for everything.
Thank you very much.
Okay, thank you. You were, yes, please.
Let me take just a few minutes, but I'll be crisp. That's an in word for all of us on the board. I really appreciate all the kind words. Obviously, we're all a team. We all do these things together. It's been an amazing experience to have been your colleague. And we've done a lot of things. Some of these were mentioned here. But this hospital system and our physicians and our staff and our whole family and our board are really special. And together we've done a whole lot. I think back, one of my first meetings, I came on in November of 2004. One of the first big meetings was in Northport, where they were talking about wanting a hospital. And we said, we will do our utmost, but one thing we commit to you is that in the near future, there'll be a 24-hour ER down here. So we all left there ready to go. We bought 2 pieces of property. That was our commitment. One piece of property was for the 24-hour ER. The other was for the final hospital when it could be done. Now, that still hasn't happened yet, but it's on track. It's in our strategic plan. And that's another thing that I think this board and our administration, our leadership has done extremely well. We've been very strategic. We've planned ahead. We've thought ahead. We've done things in the order in which it was possible to do them. We now have 6 urgent care centers, for example. We've all been a part of that. So we've just done a whole lot of things. One other thing I think about is when we did the new tower, when we approved that $250 million project, we were going to self-finance except for $100 million. So the community was not asked to pay for anything other than the taxes which they contribute, which is about 7% of our revenue. So when it came time to do the bonds for the other $100,000, my name is on every document. It was a long lawyer's table. You went around and signed sheets because I was chair that year. So I came home that night and I said, I've just signed for $100 million. And my husband said, are we going to lose the house? So that's a fond memory. Another fond memory is all our trips to Tallahassee, which some of you have not had the pleasure of doing yet. But we go in a van or 2 vans. We meet at 6:30 in the morning. We drive up, and then we meet with the important officials there, our own delegation and other folks, to chat with them, to talk with them, to carry our story about Sarasota Memorial. And it was rigorous. We did it in 5 hours by car. The criterion for going was you had to be able to only stop once on the way up and once on the way back. So those are the kinds of memories that added to all these very important things that have happened with the hospital I'll think about forever. I know this system is going to continue to perform superbly. We have wonderful leadership, wonderful staff, wonderful physicians. It's going to be a great board. Always has been a great board. And sort of a last thought. In 2004, our revenue was $425 million about. Now for the FY17 estimate, let me get this right, we're projecting $720 million revenue. Look at the growth, the superb work that's been done to provide the very, very best care for all of our folks in Sarasota County. So to all my colleagues, it's been an honor to have served with you. You have my admiration and respect. I value our friendship. I'll continue to support the hospital in every way I can. And I wish you all continued great success. Thank you.
This is real heavy. You want to give it to the Admiral? Yes.
Oh, gosh.
And now I'd ask John DeJong if he would step up, please. John.
See you, young man.
John DeJong also has been on our board a shorter period of time. but I think it was quality time that he put in on the board. It isn't always the amount of time, it's the quality of what you put into it. John has always been in the discussions, he always brings up questions, he's always trying to learn more. He's been quite the gentleman on our board, and we appreciate your service very much.
Thank you.
Thank you. We also have a plaque, and I'd like to read the plaque to you at this time. John DeJong has served with distinction and dedication as a member of the Sarasota County Public Hospital Board and member of Physician Services, Inc. Board. And whereas John DeJong is hereby recognized for his business acumen, leadership, dedication, and enthusiasm. As a board member, he helped guide the organization through new programs to enhance patient care, including the development of the new St. Armand's Urgent Care Center, Trauma Center designation, and the launch of FSU Residency Program. During his tenure, Sarasota Memorial received numerous honors, including 5-star quality rating from CMS, U.S. News recognition, the Gallup Great Workplace Award, and many others. And whereas John DeJong has played a key role in facilitating the addition of new community members to the board committees, his commitment to SMHCS has been second to none. He selflessly has devoted countless hours to meetings, employee gatherings, and strategic planning sessions. He always makes himself available for any issues and events connected to the hospital, working tirelessly to ensure top-notch patient care. And whereas John DeJong has worked hard to promote the health and well-being of the community and serve as an advocate for Sarasota Memorial. Now, therefore, be it resolved that although John DeJong is completing his tenure on the board, his colleagues and the community are grateful for his excellent service to the organization. His many talents will stand him in good stead as he moves into the areas of service in our community. Be it further resolved that John DeJong will be honored for his outstanding leadership, and his name and accomplishments will be set down upon the records of this great healthcare system, and is signed by David Verender, our CEO, and myself as chair of the board. John, congratulations and thank you, sir.
Can I say a couple words, Mr. Chair? Do you mind if I say a couple words?
Well, no, I don't mind at all.
So I'll tell you, I have gotten a chance to know Mr. DeJong over the past year when he came onto the board and he took an appointed position. He has been an incredible supporter, somebody I've always been able to go to and talk to about different issues, get his expertise. He was obviously brought here, I think in large part by Mr. Towler, who has always been a close friend of this organization as well. Mr. DeJong, I did not hear this our chairman reading your plaque, but has had a long tenure of giving to our foundation and being a member of the foundation. We are excited that you stay with our foundation and work with them on projects in the future. And I just thank you for everything that you've done.
Thank you.
So thank you very much.
Well, thank you both, David and Craig. It's a pleasure to have served on the board and meet new friends. This 2016 has been a crazy year, starting with the retirement of Tom Towler, which made my appointment, then the departure of Alex Miller, the retirement of Bob Strasser, and then, of course, the election and our new surprise president. Speaking of the hospital itself, some of the achievements that have been made are kind of unbelievable almost, and I was just privileged to be part of that. The opening of the Urgent Care Center at St. Armand's Circle, the groundbreaking at Newtown, which I think would be a tremendous addition, then the opening of the rehab facility next year in the next couple of weeks, And I think so much of these things I go to the credit of Dave, your staff. They've done a marvelous job, and it's been a pleasure for me to have the opportunity to be part of that. In addition, I think my wife and I have been supporters of the foundation, and we will continue to do so. And as a matter of fact, I will be joining the foundation and trying to become part of the development committee, and I may be knocking on your door for a contribution, which I think goes to a tremendous resource. I think the foundation, I just got the new magazine. Close to $2 million have been turned over to the hospital, which I think just goes to the credit of the foundation and all the people that have made contributions to the foundation. And so I hope that I will be able to continue our effort. And as I said, it's been an honor to be part of the organization, and I look forward to continue to maybe make a small contribution. Thank you all very much.
How do you want to do this? You want to sit down and I'll hand?
Okay.
Yep.
Our next item on the agenda will be our speaker for today, Dr. Mahfouz El-Shahawi, a cardiovascular disease prevention and better than pounds, and 1 ounce of early cardiovascular disease prevention is better than pounds of late cure. Dr. Howie is a cardiologist in the area. I must say that he has been my cardiologist for the last 15 years. He does a tremendous job, and I think he's kept me in good health, so I have to listen to what he says. So, Dr. Howie, welcome.
Thank you very much, Mr. Chairman, for this nice introduction, and I appreciate the invitation, and I think the material today will be relevant to keep Mr. Carter another 100 years alive.
Oh, good.
Cardiovascular prevention.
I like that.
So what I would like really to discuss, the material is too much, so I decided to have you a handout so I cannot present all the data here, but for you, for your own interest and benefit, please read it. There's a lot of good information, which for cardiac prevention, very timely. Now, the topics today, as you might see, 1 ounce of early cardiovascular disease detection early, and I underline the word, and prevention is better than pounds of late cure. Why is that, and how we do this? Now, every meeting I have done over the last decade, which all over the world, I have always been proud to present the picture of our lovely hospital here, and if you have a better picture than that, please let me have it. Now, the learning objective today is to emphasize that atherosclerosis, hardening of the arteries, very prevalent, silent, and I underline the word silent, disease, and starts in childhood. About 60% of the asymptomatic population, and I underline the word asymptomatic, have more than one vascular disease, polyvascular atherosclerosis. Today, the whole purpose to emphasize the importance of early screening with state-of-the-art tools for detection of silent cardiovascular disease. You may or may not know that cardiovascular disease is the leading cause of death for men and women, not only in the United States, but all over the world, and most likely more even in Sarasota, Florida. As a matter of fact, if you look to the first men and women here, cardiovascular deaths, to more than the next 5 causes of death combined. So you can imagine how prevalent this problem and how dangerous it is. So why there is a need then for early detection, prevention and treatment of cardiovascular disease in asymptomatic subject. Don't say I feel good, I don't have to see a doctor. Asymptomatic subject. In over 50% of the victims, the first symptom of asymptomatic atherosclerosis is a sudden cardiac death or acute MI. I'm sure many of you have seen that. People, friend of you or neighbor who already feeling good and never want to see a doctor, bingo, all the way down on the floor. So this is a problem. It starts in childhood, and be careful and give more attention to that. So the problem really not knowing the risk. The traditional risk factor miss the majority of high-risk patients. High blood pressure, high cholesterol, all that still miss the risk for the patient. So we needed tools to start to assess the cardiovascular disease early. And that is very important, particularly for you if you want to be one of the top in the country to start give attention more to that area, which is very, very important at the time being. Why do risk scores? Studies show a physician estimate is only accurate 24%, only 24% of the time. They're accurate when they tell you have a problem, as far as done the risk score. So routine use of optimal, and I underline the word optimal, risk scores lead to greater use of guideline-based therapy and improvement in outcome with no harm identified. So don't all say, I feel good, why do I see the doctor for? So how physicians today assess the cardiovascular risk? Many of you have heard this old risk factors called Framingham risk score, and they tried to update that from early 60s, now 2013. The American College of Cardiology and American Heart said, do a new risk score. But remember, this risk score based in epidemiology, not personalized. Framingham, a city in Massachusetts, where the people live forever, not like Sarasota going every day somewhere else. And they could follow them up, and they found after 10 years that people who had a high blood pressure, who were smoking, high cholesterol, have more deaths, and they came with a risk score. But over the years, we realized that this is not adequate. So the ACC and AHA added to that diabetes and clinic. It's still popular epidemiology. We need to have a risk score which is for early detection and is really individualized, personalized. Sometimes you don't need really risk score calculator to recognize the high-risk patient. You can see them all over the place. There will be no problem with that. It's time to move beyond global risk score, like Framingham, to personalized, evidence-based identification of early. So how is that done? And before I go to that, you'll hear another very surprising story to you, and was for me when I read this information too. Most doctors don't realize that our body is a giant network of vessels over 60,000 miles, and 99.99 of it is microvascular and barely visible. We're not seeing it, except with these specific tools. So these microvessels function very similarly, and their endothelium, the lining inside, is the most important part of the cardiovascular problem. So really we need to go after that. That is where the current state of the art moving. Here somebody said, the 60,000 miles, you can cover 3 tennis courts with your microvessels. I'm sure you could not believe that, and you never think that could be a reality. So the scanning test for early detection and determining the cardiovascular risk, what we adopted here, and thanks to the foundation, Mr. I would like to see that the foundation have been very grateful when God helped us get the equipment. I started here at Memorial Hospital in 2008. We adopted that. We were the first beta site to the University of Minnesota, and that was really great program, and we'll see the data shortly. Vascular evaluation, cardiac evaluation, and modifiable disease contributor. Here's the risk score. This is a test on the left. If all normal, 0, borderline 1, so maximum 20. So if you get less than 3, you are low risk, 3 to 5, medium risk, high risk. That means we talk early low, early, medium, early, high. This have been validated by Dr. Cohn at the University of Minnesota along with his staff. They followed. If you are down here at the low risk, the red line here, so you have already like a life insurance already for many years without any problem. If you, next one in the blue, if you are intermediate risk, then after so many years. So this test is very, very informative, and I encourage all of you to start thinking about doing something like that. So I will briefly talk about some detailed study which is done at our Health Assessment Center in over 2,500 asymptomatic subjects. We screened over 2,500. And we were surprised to find all these people who thought they have nothing, have significant thing. It's good, nothing wrong with that. Early detection is more important. So that's the way till you get heart attack, which resulted in presentation nationally and internationally, over 70 presentations. And this picture, which you saw earlier, I keep taking with me to all these places. So here's one, which is very interesting. Back in 2010, when we started the program, we had about 666 female asymptomatic, and we get the Framingham risk score, which is very popular. On them, all of them low risk, as if they have nothing. When we applied this test to them, the same people, the majority of them were low risk, sorry, not low risk, intermediate to high risk. So that emphasized the importance of getting and moving with the state-of-the-art procedure and determination. That is why early screening with more accurate risk score method must be mandated by those who care about our health, which you are. Take-home message from what I have said. Number one, and you remember that here, board members, medical management must shift its emphasis from treatment of advanced disease, wait till they get heart attack, to early detection and prevention of disease progression. Early detect to protect. Keep that really on your bedside. Second, early therapy aimed at this progression could drastically reduce the cardiovascular stroke morbid event and not just save your heart and the brain, but also reduce the cost of health care. Third, traditional cardiovascular risk factors for early detection and risk for cardiovascular are not reliable. Remember, if you forgot about everything I said, remember that paragraph. Remember, most cardiovascular diseases are preventable, but not curable. Most cardiovascular diseases are preventable. It is time to give your cardiovascular system the attention it needs by expert and dedicated team utilizing cutting-edge diagnostic tool. Be good to your heart. Now, a few words here about, all of you hear about the risk factors and what are they and so forth. I thought to put some in your handout, but just briefly discuss them. Non-modifiable risk factor, old age, gender, also you can change that these days, ethnicity, family history, and previous stroke. Okay. Then the modifiable risk factor, which you have been living with, high blood pressure, high cholesterol, smoking, etc. And this is already in your handout. You can read it in detail. So a few words about optimal management, which you probably all of us, what I'm going to do. It's always, anytime we approach the patient, we give him non-pharmacologic treatment and pharmacologic treatment. Non-pharmacologic, we call therapeutic lifestyle. I look at it, and I remember it, thinking like a globe. North, nutrition. East, exercise. South, smoking, spirit, and whatever S, another S you can put down there. Stress and so forth. And West is weight reduction. That is really the therapeutic lifestyle change, which is very lovely and nicely here. So remember that slide. Keep in mind, how the hell am I doing that? Now, the Surgeon General back then, he say, the second leading preventable cause of death is attributed to dietary factor and physical inactivity. See how important exercise and nutrition are. Appetite is your worst enemy. So the dogs so watching the cat and controlling themselves, so when you watch the food, you control yourself too. Eat a good breakfast, share your lunch, give your dinner to your enemy. When you exercise, You exercise, the American Heart say, over 30 minutes on most days of the week, but don't exercise that way, my friends, or that way when you're going to the gym, you're taking the escalator. So that is the problem. Now, the final advice, optimizing the use of evidence-based and personalized medicine in early diagnosis and management of cardiovascular disease would reduce or delay the onset of cardiovascular disease and would save lives. And of course, lifestyle change, we talked about that. Last departing take-home message. Our goal and mission must be to decrease, delay, or best eliminate cardiovascular, early detect again to protect. Now we have to be all healthcare provider and preventive, so that the children know the grandparents and become grandparents themselves, and grandparents should live long enough to enjoy their grandchildren. And I hope that with that in mind, that the grandparents, the grandchildren will enjoy themselves for years to come. Thank you very much, and I'm open to any question you might have. Any
Mr. Chairman, I have a question.
Yes, sir.
I noticed you had the red wine at the bottom of your directional sign.
Did you
And-
not see anything else said?
Well, I did notice that. And so
Red wine,
my,
I know you're coming back to the French and red wine.
yeah,
Of
just
course,
briefly, is there any truth to a glass of red wine?
to some extent, and the red wine, and talk about France, in moderation. Again, in moderation. Okay, can have some of us the later effect, antioxidant, and this type of thing. But don't say I told you that. All right. Any other questions?
That's it.
Okay.
Okay.
And what else? All right, thank you. And I wish all the new board members and Mr. Ayers, new president for the foundation, all the best. And if you have time on February the 3rd and 4th, we have at the Hyatt House every year put a big cardiac prevention. We have 13 of the best professors in the country going to talk about prevention, and half a day will be for the public. You are more than welcome to and invited, and I will leave some here for you to take.
Good.
Thank you very
Thank
much
you.
for the invitation.
Thank you very much, Dr. Shahawi. And I'll check with Ramona for my next appointment. Next, we have our awards. We'll start with the Excel Award. David?
Thank you, Mr. Chair. Second here. So I'm excited to announce our November Excel Award winner, Kirk Okamoto. Kirk, come on up. So Kirk is our November Excel Award winner. He's a senior clinical systems analyst in our clinical and business systems, and he's been with Sarasota Memorial since 2001. It's clear from Kirk's nominations and his coworkers share a mutual respect for his work ethic. All agree that he not only works hard, he also works smart. His peers describe Kirk as a positive, creative, and clear communicator. He's very efficient, one coworker says. He continually finds a way to get done in 2 hours what it takes the rest of us 4 to do. Kirk has a smile ready for anyone needing assistance. He juggles many projects and is always looking to help doctors and nurses improve patient care. Kirk encourages everyone to brainstorm solutions and enjoys coordinating team-building activities. One coworker noted that Kirk's pulled pork recipe contests are especially productive. That's a little hard to believe. Is that what you guys are doing down there?
Yeah, team building.
Yeah, all right. Thank you, Kirk, for everything you've done. We appreciate it. And DiVirgilio going to come up?
Congratulations. We have a little something here for you. The Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. Hospital Board and Administrative Staff of Sarasota Memorial Healthcare System recognizes you, Kurt, with the Excel Award for the month of November 2016, and it's signed by David Beringer and Greg Carter. Congratulations. Well deserved.
Oh, this is The only reason I stand here is because of the excellent and supportive staff that I work with. Thank you for the opportunity, and thank you for the nomination.
Next, we have our Physician Excel winner for the third quarter.
Sorry, got them out of order. So I am pleased to announce that our Physician Excel Award winner for the third quarter 2016 is Dr. Tom Nutter. So Tom, can you come join me? Good to see you. I told you I was going to do this to you again.
Yeah, that's right.
So Dr. Tom Nutter is our Physician Excel Award winner for the third quarter 2016. Dr. Nutter is an anesthesiologist and has been on our staff since 1991. Dr. Nutter's coworkers call him a role model and a true professional in all aspects of his position. He's respectful of staff, patients, and families, and always pleasant and kind. He's a great supporter of the PACU staff, they say, and is always approachable. Dr. Nutter is proactive about pain management for all of our post-op patients, the staff says. He will utilize different modalities to ensure safe, effective pain control is achieved, and each time he will explain the rationale to staff, which is so important. Dr. Nutter feels every situation is an opportunity to learn and improve. His staff says he's a great teacher and a positive team player whom they truly appreciate. So Dr. Nutter, thank you for everything that you've done.
Thank you very much.
Appreciate it.
We have a little something here to, so you can remember this day. It's the Physicians Excel Award. Excel recipients are physicians who are recognized as role models of excellence. Superior in performance, they are leaders who consistently demonstrate a collaborative team approach in their work. These individuals strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in our community. Hospital Board and administrative staff of Sarasota Memorial Healthcare System recognizes you, Dr. Thomas Nutter, with the Excellence Award for the third quarter of 2016, and we really thank you for everything you do and your excellence. It's signed by David Berenger and Greg Carter. Congratulations so much. Well deserved.
And I want to thank everyone, the hospital, the staff, administration, everyone for this. Without you, I couldn't do it at all.
Next is the Leadership Award for the fourth quarter.
So I'm also happy to get to announce our Leadership Award for the fourth quarter. Dana Rickard. Dana, come on up. Stand by me so I look good. All right. I know it's a hard job. You're all right. Dana Rickard is our Leadership Award winner for the fourth quarter. Dana is a manager in lab services and has been at SMH since 2008. Dana's Leadership Award resulted from many colleague nominations as well as some high praise from several national vendor partners who wanted to recognize her efforts. Everyone is on the same page when they talk to Dana. Phrases like true professional, dedicated, and extremely detail-oriented are common. They also say she is a hardworking, unselfish leader who is always willing to help, fix, and teach. One coworker summarized Dana as a star inside and out of SMH. That's because lab directors from other hospitals often seek out her help. Her hemolysis rates are among the lowest in the nation, a benchmark set years ago and sustained to this day. So Dana offers guidance on quality improvement. Dana has received a Vendor Quality Award for pioneering blood collection practices designed to enhance patient care. Additionally, her leadership and commitment to Sarasota Memorial Specimen Quality Improvement Project has helped make it, to date, one of the most successful studies of its kind in the country. Thank you, Dana, for everything you've done and continue to do. We appreciate it.
We have a plaque also for you, and it's a Leadership Award. If your actions inspire others to dream more, learn more, do more, and become more, you are a leader. And that's from John Quincy Adams. The Hospital Board Administrative Staff of Sarasota Memorial Healthcare System presents you, Dana Rickard, with the Leadership Award for the fourth quarter 2016, and it's signed by David Berger and Greg Carter. Congratulations so much.
I'm standing by you if that's all right.
That's okay.
No, go ahead.
So if I'm not crisp with my answers?
You're, no, not at all.
I just want to thank everybody for giving me the opportunity to do what I love to do every day, and that's make sure we provide wonderful patient care and for us to have such a great organization. Thank you.
Thank you.
Our next item is the report of the medical staff by our Chief of Staff, Dr. Scott Stevens.
Thank you. I have a recommendation from the Medical Executive Committee to approve changes to the bylaws of the medical staff.
I move approval of the changes to the medical staff bylaws as approved by a vote of the medical staff and recommended by the Medical Executive Committee.
We have a motion and a second. Any questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes. Yes. Opposed? Motion passes. Thank you.
No other issues?
Good. Thank you, Doctor. Next, we have our foundation report by the new president, Mr. Mason Ayers.
My glasses on. Thank you, Mr. Chair. First of all, I just want to say it's a true honor and privilege. Good afternoon. I have a brief report. Wanted to first touch on some of our event activity that has occurred over the last month. We had an event called Key to the Cure on October 27th at Saxon Avenue. This is the 11th year that we have partnered with Saks. And we've raised over $1.3 million during that time. This past event, our attendance was over 1,000 people. And it was a great success. And we're going to look towards continuing partnership with them. We also have a couple events coming up. We have our Corinthian Society Celebration Dinner, which is going to be on December 1st. It's going to be at the Sarasota Yacht Club. It's our annual donor reception. We're expecting between 150 and 200 attendees. And then also in January 27th, we're going to have our Women in Medicine event. It's going to focus on cardiac care. And we're looking to have about 400 attendees for that event. A great educational event for the community. Our goal this year is to get about $85,000 in sponsorships. And last year, just to give you some point of reference, we had about $34,000. Have a lot of interest in the community to support that event. That's my report.
Thank you very much. Secretary's report, Jim Meister.
Thank you, Mr. Chairman. I'd like to review the December calendar. Our next board meeting will be on December the 6th, starting at 8 o'clock with board breakfast, followed by Quality Committee, Mission and Planning, and HR Committee. The next date on the calendar of significance is December the 17th, which is a Saturday at 9 a.m. to 12 p.m., the Rehabilitation Pavilion grand opening for all of us to attend to. And then the last note for December is December the 19th on Monday from 10 a.m. to 11 a.m. The Corporate Compliance Committee will meet. 11 to 11:30 review of the financials. 11:30 to 12 p.m. peer review, and then the public board meeting beginning at 1 o'clock on December the 19th. That is the end of my report, Mr. Chairman.
Thank you, Jim, very much. Next, we have our Treasurer's report from Joe DiVirgilio.
Thank you, Mr. Chair. I have one item this morning. That's approval of the bad debt and charity care. And a motion, I move approval of the bad debt and charity care for the month ending October 31st, 2016 in the amount of $14,361,000.
We have a motion and a second. Any questions, comments for Joe? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. Operations report, our Chief Financial Officer, Bill Wolchin.
Good afternoon. I have the financial highlights for October. And with October being the first month of our fiscal year, the fiscal year-to-date numbers match the month. For the system's operating revenue for October, $59,899,000 compared to a budget of $57,062,000, sorry. For total expenses for October, $58,984,000 compared to a budget of $57,462,000. In operating income for the system in the rating agency format, for October, $3,839,000, which generated an operating margin of 6%, compared to a budget of $2,695,000, or an operating margin of 4.4%. The average daily occupancy for the hospital in October was 465, compared to a budget of 434, and the average length of stay, 4.51, and last year it was 4.77. Admissions for October, 2,764, compared to a budget of 2,389. Surgical cases in the hospital, 1,767, compared to a budget of 1,733. We also had 329 births in October compared to a budget of 307. Our outpatient registrations for October, 34,723 compared to a budget of 33,950. Emergency care center registrations, 10,187 compared to a budget of 10,352. And our case mix index for all patients was 1.87, and for Medicare patients, 2.03. Mr. Chair, that concludes my report, unless there's any questions.
Okay, thank you, Bill. No questions. Our next report is the report from our Chief Operating Officer, Lori Lang.
Good afternoon, Mr. Chairman and members of the board. Today I'd like to do a brief update on our graduate medical education program, on the opening of our rehab pavilion, and then Cyber Rounds, a program that we're piloting in our hospital. Our internal medicine residency program, as you know, we have started our recruitment season, and we have 13 available spots for a PGY 1 level residents. We have received just over 4,000 applications for this program. That was made up of representing 51 graduates from Florida schools and 448 U.S. medical school graduates. Of those 4,000 applications we received, 227 received invitations to come in for interviews. 192 have been scheduled, and those will be done over 16 days between November and January. And so underneath at the bottom of the slide is our timeline. So the interview season is, as I just mentioned, will end in January. And on February 22nd, we submit our rank list, as well as medical students submit their preference of where they would like to do their training. And the two rank lists are submitted to the National Residency Match Program, which is, I like to think of a supercomputer someplace in Indiana. And on March 17th, we all hear the good news of which residents will be receiving, and the residents receive an envelope when they're in medical school in a big auditorium, and they learn where they're going to be spending their next 3, 4, 5, or 7 years of their life. And then they will come to Florida The week before July 1st, to begin their orientation, they will spend a few days in Tallahassee at FSU, a few days here for orientation, and they will become practicing residents on July 1st. Our rehab pavilion, there used to be a Sunday night TV show that was called Extreme Makeover, where they would make a house in a week. I'd like to consider this extreme construction. It is going to be a race into the finish line, but I'm confident we will do it. The inspection by ACA is scheduled for December 12th. We will be hosting a donor reception, which will be sponsored by the foundation on the evening of December 16th from 5:30 to 7 o'clock, honoring our donors that have supported the foundation and the hospital. On Saturday morning, the 17th of December, we'll have our community grand opening. We will have tours starting at 9 o'clock. We will have a ribbon cutting and a ceremony at 10:30 in the morning. We will be transferring patients the following Monday, and as soon as 9 and 10 East Tower are empty, we will begin doing an upgrade, pretty deep cleaning, so that we can turn those floors around and those 34 beds on those 2 units, so we can accommodate the growing demand for services on those 2 floors. We believe those 2 units and those beds will be operational by mid-January. After season, we will take those out of service and we'll do a complete overhaul of those 2 floors. I'd like to talk very quickly about a pilot that we have started called Cyber. It is with an S, not with a C, so it is not virtual. It is rounds that are considered structured, interdisciplinary, and at the bedside. So if you'll think of this as low tech, high touch, and it's an approach toward patient rounding and effective communication. You'll notice that there's a trademark at this. Whoop, there's a trademark at the end of Cyber. And this was really started at Emory by Dr. Jason Stein. He's an academician, and he trained at Emory. And he knew that there was really a very effective way for residents and attendings to round on their patients, which is typically at 5 or 6 o'clock in the morning. But after those rounds, those physicians really knew what was going on, but perhaps not everybody else on the team did. So he actually studied this and said there has to be a better way. And he felt that the most effective way to communicate was with the patient at the center and with everybody on the team participating in the rounds at the same time. And so he has created this rounding phenomenon called Cyber. And I have to give kudos because this really was championed by Jan Mock and by Dr. Hamid in their last year as Chief of Staff and as our Chief Nursing Officer, because they felt that this really was evidence-based as best practice, and they wanted to bring that here.
Everyone is a key player in, deciding what the next steps are, how we can achieve the best outcomes for patients. And I think that patients are able to really feel like a part of that.
I think we do need to do better transitions of care, and that means getting everybody that's involved in the patient on the same page. Cyber is an acronym for Structured Interdisciplinary Bedside Rounding, the results of which have shown decreased length of stay, decreased cost, decreased hospital-acquired infections, and increased patient engagement and patient satisfaction. It's very structured in that there's a set time where we begin, and if the patient is giving one story one time, as opposed to relating a story multiple times where there could be inconsistencies. It also gives you an opportunity, because you have a script that you're running through, to make sure you're hitting everything you need to do. We're synchronizing all of our thinking and all of our planning at once. We don't have to talk through the entire plan at that time, but we can set an agenda. Cyber is actually just a part of an accountability care unit, which is essentially what we're trying to create. Not only do you have the bedside rounding, but you have the geography of everybody same unit.
Virginia Commonwealth University.
Oops.
Which college? Which college?
Virginia Commonwealth.
Oh, Commonwealth, okay. I think this is where you...
So just a few comments if you weren't able to hear. Cyber is done on an accountable care unit, and that means it's a dedicated group of individuals that reside on that floor. So a hospitalist or a surgical hospitalist or an attending takes care of those patients on the same floor. And they collectively take responsibility for those patients, their clinical care, the outcomes, the patient experience, and the cost of care and its procedures. It is a dedicated unit-specific, multidisciplinary rounds focused on the patient and including the patient and their family and their interactions. You can see that the patient is centered, and these are typically the individuals that are associated with cyber. The physician leads the interaction. It is with the nurse, the social worker, the pharmacist, and perhaps the unit manager, and if physical therapy is involved in the care, they may participate as well. The rounds are relatively fast. They're structured and take between 3 and 5 minutes, and as I commented, family member interactions are strongly encouraged. The features, as what you would expect, they happen at the bedside. They typically happen around the same time every day, between 10 and 11, so family members can plan their day around this rounding. It is a 6-step prescriptive protocol where there's an introduction of the patient and the family. There's an update on the course of treatment and a cross-check with the patient and their family, going over vital statistics and current data, looking at quality and safety checklist regarding catheters, skin breakdown, pressure ulcers, an invitation for everyone around the bedside, including the family, to make comments, and then they create and discuss the care plan. These are some of the outcomes that have been proven when you institute cyber. Patient satisfaction skyrockets, physician engagement is enhanced, and discharges typically take place before 1 o'clock because everybody is on board with the plan. We see there's a reduction in hospital-acquired conditions and complications. We see a reduced length of stay, reduction in readmissions. The cost of care typically goes down, and we see a reduction in turnover by staff and nurses. The next step, we piloted this on 5 Waldemere Tower, and it began on October 11th. We are currently collecting data and will be disseminating our outcome data, and then we'll determine what are the next units where we could implement this type of cyber rounding. And Dr. Hamad and Wilhelmina Visa Ramesh would like to incorporate this type of rounding with our medical residents. And so I have to say that everyone who's been involved in this has been extremely pleased and are delighted that we've brought this to SMH. Are there any questions?
I do, Mr. Chairman.
Yes. go ahead.
Are we the only one in our market who is implementing the cyber program that you
I
know
believe
of?
we're the only one in Sarasota. It's typically been implemented in university hospitals. The video that I showed was from Virginia Commonwealth,
Right.
and it was found in Emory. It is really starting to move very much across where there's teaching hospitals because it's so effective in education and in communication.
Thank you.
Bill, did you have a question?
Do you have patient feedback on the on the pilot?
The patients do love it because they feel, especially family members, because they know if they're here between that 10, 11 o'clock, they get to ask all their questions and everybody is on the same page, which is typically the biggest complaint that we have is that no one's talking to each other and they feel like everybody's hearing and talking at the same, not talking at the same time, but have the opportunity to participate.
Any other questions for Lori? If not, thank you, Lori, very
Thank
much.
you.
Good report.
Thank you.
We'll move to our committee reports, and the Quality Committee is a closed meeting, so there's no report from the Quality Committee. And we'll move on to our Finance Committee with the Chairman, Jim Meister.
Thank you, Mr. Chairman. The Finance Committee met on November 1st. David Patterson and Jennifer Sullivan, along with Dr. Greg Altomos, presented the need for replacement of EP Lab Number 1, which is over 8 years old. The existing technology is old and physicians are unable to perform some procedures in Lab 1. They noted the clinical benefits updating the EP lab and stated that the new lab will enable total program volume growth over the coming years. The project is budgeted for year ending 2017 with a total project cost of $2 million. And I move approval of the purchase of the new equipment and construction of EP Lab 1 as budgeted for year 2017 with a total project cost of $2 million as recommended by the Finance Committee.
We have a motion and a second. Any questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
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 Opposed? Motion passes. Thank you.
The second item is Nelson Lane, our controller, presented for approval the updated list of recurring wire transfers and ACH and other payments for the hospital, which is done every year. Nelson described the control mechanism, both internal and external, are in place to ensure only properly authorized transactions occur. I also have a motion. I move to approve the approval of the updated list of reoccurring wire transfers and ACH and other payments to authorize staff to initiate and authorize as needed, as recommended by the Finance Committee.
Second.
We have a motion and a second. Any questions or comments? All those in favor of the motion, please indicate by saying yes.
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 Opposed? Motion passes. Thank you.
Then, Mr. Chairman, Mike Martin and Robert Stantos provided an update on the real-time location system. The system was approved, capital request in August of 2013 in the amount of $550,000, utilizing the hospital's Wi-Fi network and electronic tags that are attached to equipment. The system provides tracking of over $14 million in assets and provides enhanced safety for staff located in high-risk areas. The system enables nursing staff to find tagged equipment quickly and enables biomed engineers to quickly locate equipment that is due for preventative maintenance. There's no motion necessary, and this concludes my report, Mr. Chairman.
Thank you, Jim, very much. Next, we have our committee, our Investment Committee Chairman, Tram Hudson.
Mr. Chairman, the Investment Committee met on November the 1st. We met with our investment advisor, Tim Sant of Summit Investment Advisors, to review our two large investment portfolios. The first one was the retirement plan portfolio. As of September 30th, 2016, the total fund was $340 million, plus a little more. Total fund performance shows actual plan return of 9.79%. Which is in excess of the 7% actuarially assumed return. That's a big deal for the folks around the table, that our investment portfolio is outperforming what actuarially we had assumed the return should be. We spent a large part of the time in the investment committee talking about asset allocation. We specifically zeroed in on the $15 million that we have invested in the Russell Equity 2 Fund, which has underperformed for all time periods since its inception. There was a spirited conversation about investment on an active basis versus passive. and it was felt that we should examine very closely the Russell Equity 2 funds performance. And finally, in the discussion summit, investment advisors recommended that we go to a passive model on that $15 million, and they recommended that we move the Russell 2 funds into the BlackRock Russell 2500 Index Fund. And so, Mr. Chairman, I move approval of acceptance of the recommendation of Summit to replace the Russell Equity 2 Fund with the BlackRock Russell 2500 Index Fund in the SMH retirement plan as recommended by the Investment Committee.
Seconded.
We have a motion and a second. Any questions or comments? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Finally, Mr. Chairman, we spent the rest of the meeting reviewing the board designated funds and its investment performance, which is managed by Northern Trust Company. That is our very, very short-term money. Performance was viewed as adequate, and no action is required on that portfolio. That's my report, Mr. Chairman.
Thank you very much, Tran. Next, we have our President's report. Our President and CEO, David Vander.
Thank you, Mr. Chairman. So I'm going to start today, like I always do, in looking at our organizational report card. This is our fiscal year to date through October 2016, which, of course, as Mr. Wojcik pointed out, is 1 month. So it happens to be both the month of October and year to date. So we start in our service pillar, and we have our goal of being our HCAHPS inpatient goals being 8 out of the 11 domains at the 50th percentile or better. I'm happy to report we actually this past month hit 11 out of 11. So congratulations to all the team members who make that happen. On the outpatient side, we have our number of domains at greater than 50 percentile. Our goal is 55 out of 58. We have exceeded that this past month as well, and we're at 56 out of 58. In the people turnover category, we have a goal of having turnover at 25% or less for those employees that are full-time and part-time that have been hired over the past 12 months. Happy to report we're beating that goal right now at 24.4%. In the quality infection, in the quality pillar, infection prevention, our total SSI, our standardized infection rate, we have a goal being less than 0.95, 1.0 of course being the expected rate. Happy to report that we're a good bit below that at 0.82. In the finance pillar, as Bill has presented already, our operating margin goal or budget is 1.1. And right now we're tracking at 5.1, and we're tracking at 5.2. In the growth pillar, we look at our inpatient admits and outpatient OBS patients. Our goal is being at 40,451. When we track it out to the year, we're looking at 45,048, so beating that. And then finally, our outpatient registrations, we have a goal of being 773,000. We are tracking a little bit short of that at 765,000. Always we go into our HCAHPS and look at the individual goals, which luckily I'm not going to stand up here and dwell on this because there's no red on here to talk about. So we're extremely excited to be showing all indicators at greater than the 50th percentile. In the outpatient report card, we have we are at 56 out of our 58. We are missing 2 in the ambulatory surgery center, which does have teams working around that. Wanted to just take a minute and recognize in our people section that Dr. Jim Fiorica has been named our Associate Chief Medical Officer. Jim's our women's cancer specialist, has been named Associate Chief Medical Officer at SMH. He joins the Chief Medical Officer, our Chief Medical Officer, Steve Taylor, as a liaison between the hospital administration and 900-plus members of its medical staff, overseeing strategies to improve quality, population health, and patient safety. Dr. Fiorica currently serves as the Director of Women's Cancer Specialty Program, working with physicians throughout the region to ensure that women have access to the most successful treatments available. Dr. Fiorica has served as Sarasota Memorial's Chief of Staff 2 years ago, playing an integral role in the launch of the hospital's new trauma center, internal medicine residency program, and in other initiatives. So if you get a chance to see Dr. Fiorica, please pass on that. Congratulations. Staying in people, we had recently had our medical staff annual meeting, and we had the opportunity to recognize some individuals. So we honored 2 physicians for outstanding service to the hospital and the community, and installed its new leaders for 2016 and 2017. So Sarasota surgeon Sam Susu was awarded our 2016 Lifetime Achievement Award, while our plastic surgeon Alyssa Schulman was named our 2016 Physician of the Year, both extraordinarily well-deserved honors. The medical staff also installed its medical executive committee for the coming year. Our own general surgeon, Scott Stevens, was named our chief of staff. So, Scott, congratulations. Serving as top representative to SMH's more than 900 medical staff members. Like every year, our child care group dresses up the kids and parades them around. Just coincidentally, it happens around Halloween. So kids came through the halls and trick-or-treated at the various departments, and you can tell that it's not only the kids that enjoy it, but a lot of the adults that get into it too. So I just thought it was kind of neat pictures that we took while they were out and about. As Mason reported from the foundation, we had another great successful year at Key to the Cure. In October, the Sarasota Memorial Healthcare Foundation and Saks Fifth Avenue hosted the Key to the Cure, which has raised more than $1.1 million over the years to help cancer programs at SMH. And once again, as Mason reported, we had over 1,000 people in attendance. We had over 40 volunteers. The amount raised was this year was a little over 200,000, which was more than double that of last year. So thank you, Mason. Please pass on our thanks to your staff and to everyone who contributed. Also had the opportunity to celebrate one of our longest serving people that work here. We recognize retirement of Sarasota Memorial's longest serving employee, Desi Peterson, who had been part of the SMH family for more than 47 years. Known as the matriarch to the environmental services team, Desi has been a role model and mentor to coworkers throughout the community, and we just want to take another moment and wish Desi our best and as she continues into her retirement. We also had the opportunity to recognize our very own Jan Mock at a nice toast, not to be confused with a roast, as she made sure that I was told. But our Jan Mock has served in this hospital as for 41 years. In the last, I'm not sure how many it was, but I think it was around 15 as the chief nursing officer, and good friend to us all, and somebody who we've all counted on. So, you know, when you get a chance, just make sure you say hi to Jan if you see her in the community and wish her well. Staying in the quality section, or moving to quality, SMH maintains our CMS 5-star rating. So once again, Sarasota Memorial received the highest 5-star rating for overall physician quality and updated ratings report released by the federal government. The October 2016 report from Centers of Medicare and Medicaid Services shows that SMH is the only hospital in Florida and one of just 111 facilities throughout the nation to earn a 5-star rating. We also received 5 stars rating from CMS in July of this year, where just 2% of hospitals earned this. Our ongoing 5-star achievement is a wonderful testament to the entire team and the diligence that it takes each and every day to ensure quality to our patients. So, Dr. Stevens, please pass on our thanks to all of our physicians for their help in this, Connie, to our nursing staff, and to everyone else in the organization. The new Truven Healthcare Analytics Study identified the top 50 U.S. hospitals for inpatient cardiovascular services. No other hospital in the Suncoast region made the list, which is based on how well our nation's hospitals cared for Medicare patients with heart problems from 2014 to 2015. According to Truven, if all hospitals performed at the level that SMH did, more than 9,000 lives would be saved and more than 6,000 heart patients could be complication-free. In March, Truven also names SMH one of the top 100 hospitals in the nation for overall exceptional performance. So congratulations to our physicians and staff, true leaders in providing this, and special thanks to Dr. Jeff Zell and Dr. Jem Fox, who lead the cardiology and cardiovascular services. SMH also earned an A this past month in safety from Leapfrog. So we continue to earn prestigious national accolades for its high quality of care, receiving a grade of A for patient safety from the Leapfrog group. It's in its biannual safety study. It assigns A, B, C, D, and F letter grades to more than 2,600 hospitals in the U.S. The Leapfrog group reported that Sarasota Memorial is one of 844 hospitals to earn the top grade. So thank you once again to all the clinical staff making that happen. SMH spotlights quality. Our SMH recently celebrated National Healthcare Quality Week, recognizing the contributions of quality professionals in delivering expertise to the healthcare system. Daily emails were sent to all staff during the week to bring greater recognition to the healthcare quality profession and to the contributions and impact that these staff members have made with the support of the help of the employees throughout the organization. Some of the examples of the quality throughout the organizational teamwork include our quality and CLAPSI teams and quality huddles to reduce infections and avoidable hospital readmissions, interdisciplinary rounding to improve the environment of care, improving patient care efficiency and satisfaction, and implementing clinical integration to reduce cost and improve quality. Also recently had our 2016 Magnet Nursing Conference. It was held in Orlando this year. So we had a team of nurses that traveled to Orlando to attend the ANCC National Magnet Conference. Magnet Nursing recognition is the highest honor for excellence in nursing given by the American Nurses Credentialing Center. SMH was designated for the third time in 2014, a feat accomplished only by 1% of the nation's hospitals. We're currently preparing for our fourth application, which will include a site visit in 2018. And Connie, I just appreciate the offer and opportunity to have been there. So thank you for. So they put me between Connie and Jan on purpose to make sure I didn't get too far out of line. So thank you. We have, like we always do every month, we have free lecture series coming up. I would just invite you to go to our website and take a look at what we have and what the times are. This coming month, we have Dr. Meredith, Dr. Fiorica, Dr. Vesco, Dr. Nora, and Dr. Novak all presenting. And it really are great avenues for the public to get to learn about these different things we do in the disease. In the growth section, we had our Newtown internal medicine practice broke ground. Along with representatives from the city and FSU, we broke ground earlier this month on our Newtown internal medicine practice, which will provide ongoing care for adults in the community and serve as a magnet for the city's next generation of primary care physicians. Developed with FSU College of Medicine, the area's first accredited residency program will train young doctors to treat people over the age of 18 with chronic health needs. These newly graduated medical school doctors will have ongoing relationships with their patients at both the Newtown practice and the hospital. And we just do want to extend a thank you to the city government for coming and working with us on that through the mayor, Willie Shaw, and through Tom Barwin, the city manager. As Lori has already talked about, we have a pavilion that will be opening, right, Lori? Extreme Makeover Hospital Edition, right? Saturday 17th, so hope everybody's able to come and join for that. And we just wish everyone a happy Thanksgiving, and thank you for listening to us. Thank you.
Thank you, David, very much.
Any questions?
Mr. Chairman?
Yes.
Could I take a matter of personal
Go right
privilege?
ahead.
And I see in the audience Sally Schul sitting out there, and after hearing the great report on Key for the Cure, I know that Sally was one of the originators of that many, many years ago, and just wanted to publicly, it was a great event. Many of us attended, and thank you for your efforts on behalf of the hospital.
So,
And Rachel, sorry. My eyesight is not so good.
so I will tell you, Tram, she not only started the program, but she saved the program and made it all work this year. And Sally and Rachel, we couldn't be more thankful for that. So
Thank y'all.
you for everything and coming back. Thank you.
Okay. Thank you, David. Do we have anything on the consent agenda? I don't think we do. Public comments, Karen? No. Okay. Legal matters, Carol Ann.
So very briefly, from a legal standpoint, this is your corporate organizational meeting this month. Pursuant to your bylaws, the board has this as its annual organizational meeting. And so during this meeting, you will be electing your board officers for the next year.
Okay, we had a chance to discuss this at our first gathering of this board during the financial review, and I believe there's a motion regarding the board officers. Tram?
Mr. Chairman, may I move the board elect the following slate of officers for its 2016-2017 year. As chairman, Greg Carter. First vice chairman, Joe DiVirgilio. Second vice chair, Bill Noonan. Secretary, Tram Hudson. And treasurer, Jim Meister.
Second. We have a motion and a second. Is there a question or comment? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you, Tram.
Yep.
Any other business? Seeing none, we are adjourned, and thank you very much. Have a great Thanksgiving holiday.